Okay, today we're talking about isolites. I'm excited about that, and we're going to run through things. For those of you who are familiar or not familiar, hopefully by the time we're done today, you'll have a better understanding about lots of things about isolites today, all right? So I've got a few topics I wanted to go over with you, and the first thing I want to discuss is sizing and adjusting, tricks to get your isolite to fit the first time. One, that's great for patient care. We want it to fit hopefully right the first time. And two, each one of these little bags here costs about $2.50. So if we waste one or mess it up, now it becomes a $5 project. You know what I'm saying? So we're going to talk about how to get this right the first time. So I've listed here sizing it. This is a basic general guideline. It does not fit for everyone, but this is the basic, in our policy and our protocol manual, how you size and isolate based upon the adult molars and if they're in. You can see that there where there's no adult molars, a 6-year molar, a 12-year molar, or basically if you're a 16-year-old or an adult and larger, that's when you'd use a large one, okay? So you really can't really solidify that in your mind until you just get some experience, but I want everyone to know at least a basic guideline, okay? Um, Tricks for getting a proper fitting, okay? So when the isolite and the patient opens really big and it fits right in there and that bag down there and it's like, it all fits, you're like, yay. It's amazing, right? You're like, thank goodness, all right? Because isolites cause stress. They cause us stress. They can cause our patients stress. They're a great tool, but they are a boundary we have to get past to be able to make treatment, sealants, or whatever go well, all right? So a few tricks I wanted to talk about for today when it comes to isolites, all right? I'm going to put gloves on here. So the first and most common thing that we have a problem with when it comes to fitting an isolite is patients gagging or feeling the gag reflex. All patients feel gag reflexes in different places. For some people, it's on the roof of their mouth. For some people, it's around their tongue. There can be a variety of places, and trying to get a feel for where that gag happens is really important, okay? So let's talk about how we can adjust and modify this, okay? If a patient has a gag reflex, the most common place is usually the roof of their mouth, right towards the back. The second most common place would be down around their tongue, okay? The isolate is shaped in a very specific way. It's got what we call the tail, and then the fins, and then there's the bite block, okay? Those are the three major parts. Of course, this part slides onto the isolate, okay? Patients never really get gaggy because of the bite area. It's because of the fins that they usually have the gag reflex, okay? The great thing about an isolate is it's rubber and it is plastic, and you can actually trim and you can cut this, okay? However, remember, the more you cut away, the less it's going to be able to suction, the less it's going to be able to block the tongue or the cheek or whatever, okay? So what I typically will do when I find out where I got a feeling where that gag is happening, if I feel like it's kind of the roof of their mouth or more by their tongue, I'll go in and I'll actually trim away part of the isolite. Just make sure to trim away the right place. All right. So typically, if you look at it, it's this very kind of this big hump on the fin right here. All right. And then the back part going down to the bite block. If you take that and kind of level it off, that will make a big difference for you. And what I mean is you can really just take your scissors and come along here and just cut that completely off like this.
Oh, it doesn't have to be. You could just cut it straight off.
Cut it straight. Doesn't have to be fancy. It's not sharp or anything like that. And so you end up with something like that. Okay? Make sense? And that alone can make a pretty big difference for a patient. If they're still gagging beyond that, you might try once again, but once you kind of really trim this baby down and they're still gagging, it might be where your placement is, or it might just be this patient's not going to be able to tolerate at least this visit. Okay? That's number one. Now, I've got here on my list here, what if you're in there and things are still getting wet or you're fighting the tongue? How do you fix that situation? Then you're going to use cotton rolls, okay? You can take a cotton roll and you can put it down by the tongue or up by the cheek. Be willing to use one of these in addition to your isolite to help get a good fit. And we'll do a little demonstration on that here in just a minute, okay? Cheeks in the way. How many of you have tried to do an upper left molar or something like that, and it's like the cheek is covering the tooth? You're going to have to get your mirror and hold it in there, or you can use a dry angle. I forgot to bring one up here, but a dry angle is just a stiff piece of cotton. You can slide up in there and help kind of push the cheek out of the way, and that can help you sometimes to be able to see where you need to get to go. But there are some patients, despite all those things, it is still too much and it's still too gaggy for them, okay? So we're going to do a little bit of a demonstration here with some of these things. And so, Lorraine, I'm going to have you, so if you let me use this bench here, we're going to slide it up here. Awesome. And Lorraine, will you be my guinea pig? All right, come on up. I promise I'll make it quick and easy. All right, you're going to lay down right here. Okay, so let's assume Lorraine is one of our patients here, and she's here for her treatment, okay? And if you want to get a close look, y'all can definitely kind of come a little closer. And I'm going to have you scooch that way just a little bit, Lorena. Perfect, okay. So The Isolite going in. Let's talk about inserting the Isolite, all right? This is a big, bulky thing to go in somebody's mouth, all right? It's kind of a lot, all right? So imagine this. If you want to fit this into somebody's mouth, what is the best way to get it in there, all right? Your mouth, as you open it, goes from kind of a flat opening to a circular opening, all right? Does your mouth ever look like this? No, all right? It's usually circular or flat. So if you have this, which way does it go in best? All right? Does it go in best this way? No. Does it go in best this way? No. It best goes in this way. Does that make sense? Sliding your Isolite in this orientation or this orientation is the quickest and easiest way to get it to go in there because it fits the shape of their mouth, right? So if you've seen me put an Isolite in, what do? I do my little trick, and I this is when I thought about what I wanted to call it, and I call it the skinny squeeze and flip, all right? I put it in the skinny way, all right? I squeeze the fins down to get past the teeth, and I flip it into place, all right? So you slide it in, squeeze it down, and flip it into place, all right? If you're trying to go this way with it, it'll gag and go this way. You have to kind of get them to open crazy big. This is the easiest way to get in there. So I'm going to demonstrate this on this learning, okay? So we're going to go ahead and open big for me, all right? What I'm going to do is I'm going to come in here like this. I take it, and the tongue, of course, is the thing you're fighting the most, all right? You want to take that little bottom sleeve here, that bottom fin, slide it underneath their tongue, and then you're going to squeeze this on the top, and then let it flip like that, okay? And that's how it's going to go in, all right? If I go this way with it, I'm like, Lorraine, open big, open bigger, open bigger. I mean, it's you fight it like this. Or if you try and put the tail in first, you get it way back there, and they start gagging. And if you take it in like this and just squeeze the top down and flip it up, it'll slide in the quickest and easiest, all right? And you can do that really, really fast. It goes and it goes sliding right in there, all right? How do you know when the Isolite is all the way in? It's not when the fins are in or when the tail is in. It's when the bite block is in the right place, okay? So you have to watch that. That's the number one key is you have to make sure that bite block slides into the right place, and you make sure your fins are on the tongue side of the teeth, sliding down by the tongue or up by the roof of the mouth. So we'll slide it one more time. You just slide and squeeze and slip, and then you get the tail back in there. And usually my last step is to make sure the bite block slides in there, and sometimes you have to retract their cheek, and they bite down. Okay? That's, when it's all the way in. If you have the bite block out like this, or the fin's hanging out, or halfway in, or sometimes you'll have the fin on the top kind of hanging over the teeth. It's not in all the way. You got to make sure you get it all the way back into that proper place. Make sure their lips aren't kind of stuck and slide it on around like that. Now, real quickly, cotton roll wise, the cotton roll again can go various places. You can go up by their cheek up here. If you need a little extra retraction that way, you can go on their lower lip too. If they're kind of one of the people that squeezes their lips down, you can put it like this. Or if their tongue is going crazy in there, you can take it and you can slide it in on the bottom next to their tongue, okay? Awesome. I'll spare you there, Lorena. Thank you very much. You can set up now. All right. Excellent. Those are all tricks that can help you be able to get things into the right place and the right location, all right? Let's talk about now once you've got this in there, you've gone to a lot of work to get it into the right place, right? You've got exactly where you want it. And then what starts to happen from there? Either one, the patient's going to be happy with that, or eventually their tongue starts to go crazy or they want to push this thing out, all right? So how do you stabilize it? How do you keep it there? Because you've done a lot of work to get it there. And if it comes out, what do you get to do? You get to start all over again, okay? And it's a real bummer to have to start all over again. So keeping it in place is really key and important. So we'll talk about stabilizing your Isolite, okay? There's two ways to stabilize an Isolite. There's stabilizing it from the outside, and there's stabilizing it from the inside. What I mean by stabilizing it from the outside is we have our Isolite in place, locked in there, and we have, it's in their mouth. The outside would be this plastic area, okay? And if you're stabilizing it from the outside, you're probably either the primary assistant, you're maybe the head holder, maybe you're the doctor, but you're going to stabilize it by holding the stick, okay? You don't have to get your hands in their mouth. You can actually stabilize this quite well by just making sure it stays in a good, proper position right there on the outside of their cheek. So taking your hand and putting it against their cheek and hold over the top of it like this. If you're the head holder, is a good way. Or if you're the assistant, keep your fingers up, but just keeping that in position is really key. And what you want to do is aim and make sure you're pushing it and holding it so their teeth are staying in the bite block. If you do that, you'll be able to handle about 80 or 90% of the stabilization issues by holding it on the outside like that. And what you'll notice is a patient, if they're used to having you hold it there, as soon as you let go, what do? They push it right out. So sometimes I'll ask assistants, can you hold this for me while I reach over? Because I need to use my two hands for a minute while I get something, and you'll stabilize that side to help hold it in place, okay? The second place you may need to stabilize it is on the inside, all right? And usually the place where you have trouble with this is where the tongue is going crazy and it's pushing that fin up and out of the way, right? It might be in place, but they're pushing that fin up over the teeth. Again, so there's two really good ways to stabilize the inside. I showed you the cotton roll. Taking that cotton roll and tucking it down in between the fin and the teeth will help them, and pushing it down below their tongue. Their tongue really at that point can't get that out, and it kind of ties their tongue up so it can't move around much, okay? That will help you, and that's one way. And the second way, of course, is to use a mirror to slide that down in there and to pull the cheek or pull the tongue back out of the way too, all right? So those are the two ways you're going to internally stabilize that Isolite. As we go through the process as well, okay? And those are the two things I want to make sure we talked about that from that standpoint. The last thing is we do have some patients who just will not open big enough or open period for us to be able to get this in there. And the way we use our tricks to get that to happen is you have to use a mouth prop, okay? Those of you who don't know, this is what a mouth prop is. Kind of looks like a pair of scissors that makes this kind of ratcheting sound, all right? Dr. Allen calls it the ratchet for some reason. All right? This goes in like this into the mouth, and then these rubbery parts, the teeth bite on, and you can actually do this, and it locks the mouth open, okay? And this is sometimes going to be the best trick to get the Isolite in. So the trick is, where do you put this when you want to put this in, right? So because you've got all this contraption going on, you want to make sure this is going on the opposite side that you're putting the Isolite in on, okay? So if I'm putting my Isolite in over here with my stick coming out this way, you need to put this over on this side. And you open them up, and this will allow you to slide the tongue and the fin and the cheek and everything in on the other side, okay? And we use that to get it open, put that in place. And if they're really, really squirmy, sometimes we'll just keep this in. If that's just enough to get it in place, we'll slide this on out, okay? But that's the trick, all right? So if we have a patient who's gone through all this and still can't quite tolerate the Isolite for whatever reason, the gaggy feeling, they can't seem to tolerate, then we do have a very last resort we can attempt to do, and that's the good old-fashioned method of the mouth prop, bite wing, or the triangles, and the cotton rolls, all right? If you've ever done the sealants that way, you find out it's kind of a pain, but that's actually how we used to do all of them, all right? So that is one way, and if you ever get to that point, I'd be happy to show that and demonstrate to you how to go about doing that, okay? So there's kind of the Isolite in general and a few tricks and things, and I want to make sure those of you, especially in the clinic, who are using the Isolite, get opportunity to do those things. And if you have any questions, please don't hesitate to talk to doctors about how to better use the Isolite and get it to fit in place, all right? A few other tips. It's really important to show patients what this is, all right? And talk to them about it. For the kids, we've called it the mermaid or the dolphin or whatever else. Or if you have your older patient, show them exactly how it's going to work, where it's going to slide, because it does look intimidating when you have this. This is going to go into your mouth, and it kind of looks scary, okay? It's so important to show them how it works, how it folds, how soft it is, where their teeth are going to go, how the light turns on, how the suction sounds. Be willing to call that TSD or tell, show, do is really key to helping the patient accept it so they're not nervous or stressed about it, okay? And again, like I said, letting it come out is a real pain because then you get to start all over. So keeping it in place is really, really important. Also, the best pictures we take in the clinic are ones with the Isolite in. I would warn you, though, the light should be off to take a better picture. Use the light from the camera. You'll get a better view that way, all right? And then we also want to try and minimize the amount of time the patient has to have one of these in, okay? There's lots that we need to do while it's in place, but as soon as it's reasonable to take it out, please do, just because it's not exactly the world's most comfortable thing, and have them hang that in there with that going on for a long, long time can be really, really difficult. So just want to remind you all that. Let's talk about some care and maintenance, though, of the Isolite, all right? Each Isolite roughly costs about $1,600. For this thing, that's what it costs for all this, all right? Now, which seems like a lot of money for a rubber hose, right? That's what I think. But nonetheless, it is all the same. So let's talk about the parts to the Isolite. We talked about how the mouthpiece here is just a couple bucks, all right? We go through them a whole bunch. Then you have some other parts to the Isolite. There's the hose right here, which disconnects. This hose actually is about $600, okay, in by itself. And the reason for that is it has electronics within it. It has some wiring that goes within this hose that connects with this little hub right here, all right? So that's what this costs. Then there is the head here that comes apart. There's the sterilizable parts that are here, all right? Those are about a couple $100 together. And then there's what we call the light stick on the inside, which has the hard electronics, which is about an $800 piece of equipment. Okay? So all these are really, really important. There's a big disclaimer, everybody. This piece cannot go in the autoclave. If it does, it's gone. All right? That's why it has to come out. All right? When we autoclave these two parts right here. All right? Just a reminder, don't ever put this in the autoclave. All right? Now, so where should you put it while this is in the autoclave? All right? We have a dedicated little spot next to the sterilization area, a little white basket next to that where it should go, and that's the only place it should go while this is getting sterilized. Once this thing is sterilized, these get put right back in and they go right back to the chair. It's really easy. You can imagine one of these to get tossed, chucked, thrown out, kicked under a chair, whatever, all right? So that's why we have that dedicated spot specifically for these to go, all right? Now let's talk about the ways that an Isolite has problems or how it breaks, okay? There's various ways the Isolite actually is designed to be able to tell you if there's a problem, okay? So the number one issue that we face is when you go to turn the Isolite on and you push this little fancy gray magical do everything button on the top, that it will give you, it just won't come on. It just flat out doesn't turn on, all right? And it looks dark and gray like this, okay? What does that generally mean? What's the number one reason why? Nope.
It's either the hose or the light.
It's not plugged in anymore, okay? And you just have to plug it back in, okay? So the first thing, if you're having trouble with your Isolite, the light on it, always check the plug first, okay? And that's usually the most good because it just gets unplugged somehow, okay? If that's plugged in and doing well, then just double check and make sure it's plugged in here too, all right? That hasn't become disconnected, all right? That's how you make sure you get power to the Isolite, all right? Now, if that is in place and there's still just nothing going on here, that means we have a power connection issue, okay? And what usually that will then mean, the next most common place is the wiring inside this has become broken. A very common place for that to happen is up close towards the head. And what usually will happen with an Isolite when it's starting to go out and the wire's starting to go bad is you'll be able to twist and move this and the light will kind of come on and off, all right? The number one way that this happens is because this has fallen on the floor, and what happens to it? Someone steps on it, or even worse, a chair rolls over it, okay? So if you see an Isolite hose laying on the ground or falling down, if you notice me, I always go over and I put it right back up. Because I know if someone drives over that, we might have a $600 purchase that we need to make for this hose, okay? So just be cautious and leery of that. Make sure these are always hung up, okay? So that's the next most common place it breaks. The second most common place it can break is actually right here. Is inside this little connection port. There'll be a disconnect between this and the stick that's on the inside way in there, okay? And so just double check and make sure that is cleaned out. It looks clean, doesn't need blown out or something like that, because sometimes that will go bad too, all right? If those things aren't working very well, it's probably then now the light stick. And the light stick usually will start flashing a red light at you when it's starting to have problems and start to go bad. So if you see a red light issue, write a sticky note, put it up so we can be aware, so we can do some last testing on it to make sure if it's going or not, okay? So those are kind of the three major areas where Isolites will break down and where we'll have problems with them, okay? Now, when it comes to sterilizing these and keeping them clean, the hose itself is just like all of our other suction hoses. When we run it, we just need to make sure to take this, put this into our line cleaner, and it just runs right on through just like a normal suction would, okay? It's really important that this light stick does not go through the line cleaner, all right? So don't drop this down inside your line cleaner. You want to drop this down your line cleaner, okay? Suck that up through the bucket, okay? As far as this part is concerned, of course, there's stuff that gets sucked through here that gets kind of nasty and gross. You want to, of course, get these rinsed out real well. We have some little cleaners you can kind of spray through and rinse through there. And then these go through, again, the autoclave once a week to make sure they're taken care of and they're nice and clean. All right? And then the light stick, again, it basically gets wiped down really, really well. It's pretty well encased in here, so it's easy to clean. And that's how we take care of that, that component. All right? Any questions about that?
So you can wipe the light stick off with a cavi wipe.
Yes, you can. Absolutely. You can. In fact, in between patients, we wipe this off with a cavi wipe, and then weekly we go through, put it through the sterilization process.
So like the actual stick on it. Like
The actual light stick?
No,
Yes.
maybe, whatever. The thing in the middle, the chip thing.
Yes.
That can be wiped off.
That can be wiped off. That's exactly right. The rest of it should be sterilized. Okay? Yeah. Yeah, and you have to really kind of get down in there and clean it really, really well. Okay. Any questions about sterilizing the Isolite parts and how expensive they are and how to keep them from breaking? All right. There we go. So the biggest reason we just get these broken, they have improved in their design over time. They used to break much more frequently. Now we have a little better success. It's primarily just them falling on the floor, getting run over, getting stepped on, kinking the hoses. That's the things that really seem to cause us the most troubles and problems. Okay? So there's a few tips for success with Isolite. Any questions anybody has for using the Isolite? Things here and there? Okay. To become a great dental assistant, it requires skills of learning how to become great with an Isolite. And there's lots of components to that. And I'd be happy to help anyone with any questions they have so you get familiar and comfortable with using it. Okay? All right. Thanks, everybody. Sounds good.